So I would call myself a medical imaging analyst. I look at medical images pretty much every day and sort of determine what the characteristics of that image. So my research is with renal cell carcinoma or kidney cancer, and we want to be able to quantify through computational approaches how that cancer is responding to new targeted therapy treatment approaches. So current treatment assessment involves chemotherapy and radiation and looking at how the tumor size changes over long periods of time. But that takes months into treatment. These new targeted therapy drugs will start to see responses very early into treatment, weeks into treatment. But the only way to really evaluate those changes is through computational approaches. And that's where my research is I'm taking processes and algorithms already being used for medical image processing and putting them into a sequential framework. So that way we can just take the data set, run it through these automated steps to get the final quantified output of how is the cancer responding to this treatment. Clinicians I'm talking to are really excited about this because a PET MRI scanner is very new in the field of medical imaging, and we don't know what the potential of it can be. So the fact that we're using it for evaluating treatment response has been really exciting. So again, it's very preliminary right now, but once we get a couple more data sets down the line, hopefully this framework that I've established will be able to be used for other similar data sets, as well as maybe transferable to other areas of cancer besides renal cell cancer. So when I started looking at colleges, I really knew that I wanted to join biomedical engineering as my field because I felt like that my skills in science and engineering were just a really good way for me to be able to implement helping people in the medical field. And I chose CASE because their biomedical engineering program was really established, and just meeting one-on-one with the faculty before I decided to come here really just blew me away with how dedicated they were to their research and just how interested they were in investing in me as a student. So I really felt like an actual person and not just a number out of college. So computational imaging is sort of a theoretical approach right now. Clinicians are very comfortable with the way that they will look at a medical image and sort of qualitatively say, oh, I can see the cancer is here and this is how it's changing. But with more support and more knowledge about it, we can move the stuff we're developing and research and put it into clinical purposes, so that way clinicians can be able to use our software and programs to better process and better analyze medical images and give patients more accurate results on how they're doing.